When they decide that they want to engage in treatment, this is going to be their first assignment. And I structure it, as we do in CBT. We structure a lot. We don't leave a lot to chance. We find that if you give a patient a form to fill something out on, it increases the level of compliance. This is something that Aaron Beck found out way back at the beginning of CBT. He actually was the first to produce a lot of beautiful forms. His thought records were NCR at one point, no carbon required. They had 3 copies so that, you could, I think there's 2 copies. One copy was for the patient when they'd fill it out, and the other was to give to the therapist. You know what? When people get that fancier form to put their homework on, more do it than if you just hand them a piece of paper or you tell them just to do it on their own. So this is meant to structure people. It asks them to think about their goals along 3 dimensions. The first dimension is a feeling dimension. So the stem is, I want to feel more, I want to feel less. The second dimension is a behavioral dimension. I want to do or have more, I want to do or have less. Now, there can be overlap. So one person might say, I want to feel more confident. Another person might want to say, I want to have more confidence. Doesn't matter. These stems are meant to get them thinking. It's to get more out of them. But of course, in the behavioral category, they also might say, I want to do more exercise. I want to smoke less cigarettes. I want to have more friends, which wouldn't come out in the feeling category. And then the third category, one that people often think is not associated with cognitive behavior therapy, is I would like to understand or have a greater understanding of blank. And that can be a bipartite kind of answer. I'd like to understand more about how having had an alcoholic father has affected me today. Or I'd like to understand more about anxiety and how it works. So we're going to pull out the goals from patients by using this.